Good morning. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're streaming live spine surgery. Our patient is a young man with a bulging disc at C4-5. He has not just disc pain, but also facet joint pain. We just finished his Duke plasma rhizotomy for facet joint pain. He's had neck pain for 2 years. It's very disturbing to him. It affects his life every day, daily pain. So we got an MRI. He has a small bulging disc at C4-5. We first treated the facets. He got some good relief. This was a few months ago, but now he's back because the disc pain is just bothering him too much. So we're going to treat his C4-5 disc. He has an annular tear with a disc bulge, and he has discogenic neck pain. It radiates into the shoulder. And I'm expect to find a tear, herniation in the back of the disc causing his pain. Henry, let's show the audience the 30 different causes of neck pain while I gain access through the front of his neck into the C4-5 disc. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Hey there. All right, welcome back. You could see there are 30 different things that cause neck pain, but the number one cause with about 85% of neck pain is a tear in the back wall of the disc. Monica is showing you that right now with her arrow. Do you see that line, that black line there at the back of the disc at C4-5?
Yes, we do.
That black line is the annular tear. That's where his neck pain is coming from. We're going to go in and clean that up with a laser. And that's going to get rid of the discogenic pain. We've been doing the same surgery for 19 years. In 19 years, we've gotten rid of about 98% of the neck pain. In the lower back, it's 99.6%. 99.6%. So almost 100%. So this is a very, very good treatment for discogenic pain. I'm going to make a 4mm incision. That's a very small, tiny incision. I'm using a scalpel to do that. There's the incision, folks. All right, we're going to now place a guide wire shot. When I say shot, I'm telling my X-ray technician to take a picture with the X-ray. The ray tech is in the way. Shot. I need to see the guide wire. Shot. Perfect. By the way, show us the dye in the epidural space right behind the disc, but in front of the spinal cord. Thank you, Monica. That's right. See the black dye there? That is literally dye that is in front of the spinal cord. Shot. All right, now we got the guide wire in, and we're going to place our dilator over the guide wire. The dilator has a tapered tip. That tapered tip allows me to advance. Shot. I can advance this dilator down through that 4mm incision all the way to the front of the disc and actually go through the disc to the back where the tear is. We're going to actually pass through the disc. Shot. You got to take more shots. Yep. All right. So here we are making our advance shot. I'm going to hold the guide wire steady. Shot. Just about there. Shot. You guys can see the tip of the dilator. Shot. All right. Shot. Very good. I pulled back the guide wire just a little bit. We've lost about 3 drops of blood. I need an AP view. AP. I want to check the placement of my dilator on the front-back view. Front-back view. I want to be as close to the middle of the disc as I can be. Can we straighten his head, please? Sure. You can see the tip of the dilator, folks. Stay there, Monica. The tip. Go to the computer. The tip of the dilator is perfect in the middle. I'm right in what's called the anterior longitudinal ligament. Now look at the tears on both sides of this disc. Now this is very important. This patient told me he has pain from his neck shooting into both shoulders. Look at the tears. There's a left tear and a right tear. Show us the left tear. That tear right there is why he has pain going into his shoulder, cervical brachial pain on the left. And there's the tear on the right. As a matter of fact, look at the dye making like this star shape right there. No, go to the, yes, there. That is the nerve root that the dye is layering around the nerve root. So that shows you the proximity of the back of the tear to the nerve root that goes down into the shoulder. That is exactly why he's getting neck pain that goes into his shoulders. He's got staples from the prior surgery. And Monica, stay there. Show us the endotracheal tube. Folks, the endotracheal tube is the other one. Yeah, the first line to the left. The left, I believe the left is the endotracheal tube. Go to the left. There. That line is the endotracheal tube. The braided line is the esophageal temperature probe. So you got 2 things going into the patient, one into his esophagus, one in his trachea. You can see both of them. Go lateral, please, Monica. Lateral. All right, we're going to advance. We're going to advance this dilator through the disc. A lot of people ask me, well, if you put the dilator through the disc, aren't you going to damage the disc? And the answer is no, because it's just like putting a pin through your coat, right? The pin, PIN, does not damage the fibers of your coat or shirt. It just spreads them apart. We're spreading the fibers apart right now. That's what we're doing, spreading them apart. Shot. All right, now I've gone as far as I can using my finger. Shot. I'm going to take my guide wire out and I'm going to go ahead and advance this thing through the disc. Huh? Yeah. We're going to go to the back of the disc where the tear is. Shot. Now, we're all sure this is C4, 2, 3, 4, 5. Everybody agree? Show us the tip of the dilator. Guys, look at this. Henry, check this out. The tip of the dilator is about to enter the posterior tear. You see that faint black line there? That is the tear.
Yes, we do.
So we're going to go through that tear to the back of the disc. Shot. Yep. And I'm going to put now over the dilator this tube. You guys see this tube? This tube is 4 millimeters wide. This is the future of spine surgery right here. I've tried to teach neurosurgeons around the world how to do this surgery, but they all love fusions because they make a lot more money with fusions than they do with laser, endoscopic surgery. Endoscopic surgery does not pay very well to the surgeon. Therefore, the surgeons do not recommend it to their patients. That's why we show you these videos, so you can learn the truth. Ask your surgeon, instead of doing a fusion on me, can you do the endoscopic laser procedure? The results are better than fusion. We've had 0 complications in 19 years, over 2,650 surgeries with laser. Shot at Duke Spine. No complications of surgical complication to date. ACDF has a 50% complication rate. That means out of every 2 patients, 1 of them will have a complication. That's published, and it's actually part of our board review for re-credentialing for the American Board of Neurological Surgeons. Every year we got to retake a test, and that test has on it what is the complication rate of ACDF. It's 48%. Complication rate of posterior cervical fusion is around 25%. So whether you want a 1 in 4 chance of a complication or a 50-50 chance of a complication, go get a fusion. But if you want no complications to date, come have the Duke laser disc repair. Shot? Now, I actually got a letter from the American Board of Neurological Surgeons, and they're saying, how can you say your surgery has no surgical complications? We've never heard of a spine surgery having no surgical complications. So, but that's the truth. Okay, now, at this point, the dilator keeps coming back. Why is that? That's because of inflammation in the back tear. It's pushing it forward, out of here. I can't let that happen. I've got to keep putting it back until I advance this tube far enough so that I can do the surgery. Otherwise, I'll just be biopsying the disc. I don't want to biopsy his disc. I want to remove the herniation and clean the tear. Shot? All right. That may be as far back as I can get. I'm trying to get this tube to go back just a little bit more. No, it's not you. Shot? That should have done it right there. That's about as far back as I can get it right now. Once I remove the herniation, I'll be able to get it further. Okay, questions from the audience?
Yeah. At this moment, no current questions.
Let's share with the audience how a disc herniation causes neck pain.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, we've lost about 5 drops of blood, 5 drops. Now, if you're going to have a ACDF fusion on your neck, which is what most surgeons will recommend, you're going to lose a lot more than 5 drops of blood. You're going to lose on average about 50 milliliters, 50 ml. That's a lot of blood. And a lot of surgeons lose more than that. They'll lose 500 mil. So it could be a life-threatening situation if you're having a fusion and you're losing a lot of blood. We actually had a patient here last week who barely had enough blood. She has a condition where her body doesn't make enough blood, and the only surgery she could have is our laser surgery because there's no blood loss with the laser surgery. We also get a lot of Jehovah's Witnesses coming here. Jehovah's Witnesses love our surgeries because we don't lose blood. If you do fusion surgery on your neck or laminectomy, you're going to lose blood. All right, there's herniation right there. You guys see it? Right down there, that blue thing. That is the herniation, and that is the tear. That's what we're after right there. This tear, you can see the edge of the tear. I'm cleaning it with a laser. Any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is that we cure discogenic neck pain?
I agree.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from the video how it is we cure the pain from somebody's disc herniation using the laser with the Duke laser disc repair technique. It is a curative treatment. The pain goes away permanently from the disc. You may have other causes of pain, but the disc pain that we treat will be gone with this surgery. It goes away 99.6%. That's reported by our patients, not by us, by our patients. They tell us. Every one of our patients that we operate on, we ask them what percentage of your pain that you had before surgery did we get rid of, and they give us a percentage. And that percentage could be 90%, it could be 0%, it could be 100%. And the average is 99.6, basically 100%. This is the only surgery in the world that can cure neck pain. Any comments or questions? What is our audience like?
We are at 15 viewers throughout our
All right.
platforms. And
If we don't get any questions, I'm going to have to start yelling at the staff again, cursing on them, trying to get some more views. All right? We want another viral video. All right, we've shown the audience how the herniated disc can cause neck pain and how we cure that pain using the Duke laser disc repair.
Correct.
Yeah. I want to point out that his MRI, if you look at the bottom corner of your screen, you can see the MRI. It doesn't look that bad. The C4-5 disc, most spine surgeons wouldn't even recommend surgery because it doesn't look that bad. But the patient would then have to live in pain for the rest of their life. And the problem is you don't need a big herniation to cause neck pain. You can have a small one. This patient has a small one. What matters is not the herniation, it's the annular tear. And it's really the herniation within the annular tear that causes all the symptoms of pain, okay? And that's what we're dealing with this patient. Pain coming from an annular tear and herniation. Right here is the herniation. You can see the gold color is calcifying. That means that the herniation is old. It's been there a long time, and there's been a lot of inflammation related to it. All right, just about done. I got 5 minutes left on this surgery. Dr. Berndes, I'm talking to you. I'm sorry? I already timed out the next two patients. Yep. One is going to go into room 2. That's the Peary from the Villages. We love the Villages. I love Village people. We got the Villages here in Florida. It's a very large community of people living here in Florida, in Central Florida. Largest retirement community in the world. They have 200,000 homes in the Villages. Yep. And they got all kinds of doctors up there trying to, like vultures, trying to live off those people, but none of them can cure back and neck pain like Duke Spine. Right, Luis? Sure. Luis knows. He's been checking that place out, eyeing a house, right? Your brother lives there? Seriously? Oh.
He's a psychologist.
But I thought you have to be older. Is your brother older?
He's a psychologist and
he
his
works
wife
there.
is an internal medicine.
So when you are a doctor up there, you can live there.
Yes.
Oh, I didn't know that. That's weird. I guess they let doctors that are not retirement age live there is what I'm finding out. I'm getting the intel from Luis. Your brother's a psychologist. Yes?
Yep.
And what does he think about you, Luis? Is he worried about you at all? How many other siblings do you have?
Only one. That's it.
Just one brother?
Yeah.
All right. All right, any questions?
I believe we have a question and or comment coming from a Raul on YouTube
Hello, Raul. Welcome to Duke Spine's live stream.
saying, cervical spine, my problem is at C56, C67. I'm from India.
All right. Well, my Indian friend, you need to come here to Florida so we can fix your neck. We do offer free consultation if you're interested. It's all done by Zoom. I do a lot of business in India. I think all my coders from my website are from India, from Bangladesh. And Dr. Patel is from India originally. I think, Sam, you've spent some time in India, right? With the Swamis. Sam is a product of the Swamis, the Indian gurus, the wise men.
We have another question
Yes.
coming from Sean on YouTube
Hello, Sean. Welcome to our stream.
asking, is this covered by insurance and would Dr. Duke be considered out of network?
It depends, my friend. Depends on what insurance plan you have. Insurances, Sean, the insurance companies denied 850 million claims last year, according to the Wall Street Journal. Go look at the Wall Street Journal article from February 12th of this year. It has reporting that the insurance companies, Blue Cross Blue Shields, Cigna, United, Aetna, Humana, denied 850 million procedures and tests that doctors did. So, you ask me if it's covered, I don't know. I don't know what's covered anymore, my friend. I mean, the insurance companies are supposed to cover all this stuff, but they get away with not covering it. That said, in the news, Blue Cross Blue Shield ordered by a federal judge today to pay $2.9 billion. $2.9 billion for not covering medical procedures they were supposed to. 2.9 billion. So, you ask me if it's covered, I have no idea. You should be asking your insurance that, not me. But it doesn't matter if it's covered or not, right? Because don't you want the best procedure for you to get out of pain? Don't you want the best? Or are you not worth it? I think you're worth it. If I had a problem with my neck and I had a herniated disc, I would not want a fusion surgery. Fusion surgeries are dangerous. Luis, what would you do if you had a herniated disc? Would you do a fusion? Only if I did it for you? Right? Huh?
If I need it, only you.
Only me. You would do laser, right?
Oh, yeah.
You've seen fusions. You know how bad they are. All right, my friend. Treat yourself. You only have one life. If you don't get the right surgery done, the Duke laser disc repair, you could end up with a complication and you could end up dead as a result. So stay away from invasive spine surgery. All of you, my opinion, get the best. Come to Duke Spine, get the most advanced treatment in the world. I've got about, 1 minute left, Dr. Berndes. We're just about finished here. I got to clean this scar tissue right here up. This is all scar tissue from chronic inflammation. That's what chronic inflammation does. It makes scar tissue. So, when you have pimples on your face that are just sizzling away for months, you're going to get scars in your skin. Okay? That's one of the best examples of scar tissue I can mention to you folks. Because everybody knows what a pimple does if you don't stop that inflammation. You don't get rid of it. It just cooks and cooks until your skin scars. And when your skin is scarred, it's permanent. The disc herniation is the same way. If you have a herniated disc in your neck, this is what you want. You want to get it fixed. You don't want to just let it cook and cause all this scar tissue inside the disc. Makes it a lot harder for me to do your surgery. Any questions, Henry?
At this moment, no current questions.
All right, we got about a minute or so left. I'm almost done. And I'm very happy with the results for this patient. He's going to heal up beautifully. All right, let me just flip one more time. Take one more look at that other foramen, and we'll be done. Any other questions?
At this moment, no current questions.
All right, so we are pretty much done. I'm going to finish up. If you want to show our audience about the facets that this patient also had done earlier, that way they can see kind of the two different things that cause neck pain, facets and disc, and do sort of a comparison with the videos.
Of course.
But we're just cleaning this last bit up, and then we're done, because I don't see any more herniation left to clean.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. Check it out. Can you see this?
Yes, we can.
Look how big that incision is, folks. That's 4 millimeter incision. Well, maybe 5. All right. 5 millimeter incision. No bleeding. Here is a clean rag. Here is the bloody rag from the surgery. We have like 5 drops of blood. And he's going to go home in an hour. We're going to put a little bandage on there. Finish up. And any questions for me?
At this moment, no current questions.
There you have it. Do you have to have fusion for for a herniated disc in your neck or a bulging disc? Absolutely not. Do you have to have an artificial disc put in? Don't do it, folks. Those are dangerous, invasive surgeries. You're going to live with complications. 50% complication rate. You don't want that. With this laser surgery, 0 complications in the operating room from the surgeon, no surgical complications. 20 years of doing this surgery. Over 2,650 surgeries. Save yourself from an unnecessary complication from spine surgery. Get the least invasive, most advanced surgery in the world, Duke laser disc repair. Also, we don't give our patients any pain meds after surgery. They take a Tylenol and a muscle relaxer, that's it. There's no narcotic painkillers. You go get fusion done or artificial disc, you're going to be on narcotics. Could be for even weeks or months. All right, any other questions?
No current questions.
Have a wonderful day, and we'll be back in about an hour for the next surgery, a lumbar Duke laser disc repair.